Hello everyone, my name is Pooja Pandita, and today we'll be discussing a very interesting topic which most of the nursing students come across, which is based on NMBA standards and code of ethics. These two standards are very much important for every nursing professional and they must gain a deeper understanding about this topic to demonstrate a safe nursing practice for the safety of well-being of the patients. So to begin with, we'll discuss what NMBA standards and code of ethics means. So, as we know that NMBA stands for Nursing and Midwifery Board of Australia. The board have discussed various essential standards that every nurses must comply with for a safe clinical practice. The nursing professionals, including registered nurses as well as skilled nursing, participate and work within the regulatory guidelines of NMBA. These guidelines are important for improved patient outcomes. The major actions followed by every nurse practitioner include cultural leadership, partnership with the patients, which is mostly followed by communication, organizational systems, evaluating and reporting. So these all are the actions that every nurse practitioner must include while demonstrating a safe nursing practice. Effective leadership aims to provide quality work towards the safety of patients. Strong communication skills forms a strong patient-nurse bond which enhances safety outcomes. The nurses must show a positive attitude towards their profession, and it's directly related to the positive health environment as well as a patient underwent serious in case of patients who underwent a serious mental and emotional distress. These NMBA standards will guide the nurses to ensure their safety. The NMBA guidelines have standardized the code of ethics for safe nursing practice to improve the patient outcomes of patients in Australia. So next we'll discuss what all we can gain by the end of this presentations. So this presentation will discuss a case study about John, in which John is an older patient who has been administered to the hospital. Later, the doctor delegated the work to a nurse and asked her to keep track on the vitals as well as provide medication to the patient, which the nurses failed to do. The nurse failed to perform vital monitoring after an hour, as well as she failed to demonstrate an effective and safe documentation after medication administration. So we'll discuss how the nurses should intervene and follow the NMBA code of ethics for the safety of the patient. And by the end of this presentation, we'll also gain a deeper understanding about how communication plays a safe role in the therapeutic patient engagement, as well as how documentation standard will also support a safe nursing practice. So, code of ethics. In this slide, we'll discuss what code of ethics means and how it has played a greater role in the safety and well-being of the patients. In Australia, NMBA, along with the legal framework standardized by Health Practitioner Regulation National Law, the national law has created a code of ethics mandatory to be followed by every nurse practitioner. This framework will guide them for the safety and betterment of the patients. The guidelines will include professional codes, registered standards, which is essential for the safe practices of nurses in Australia. It focuses on delivering the best healthcare services by the nurses for improved patient outcome. It was observed that the nurses in most of the cases fail to perform their duties and follow the standardized code of conduct of their professional framework in the healthcare services, which could impact patient health. Thereby, nurses are obliged legally and ethically to adopt and comply with the code of ethics for the safety of the patients. So, the principle for code of conduct demonstrated that the nurse should provide equal care and respect to all the patients without any fail. It also states that nurses must escalate the deteriorating condition of the patient to ensure the safety of the person. After discussion with the nurse, it can be observed that in case a nurse has failed to oblige with the code of ethics, the nurse should report the same error and must participate in continuous professional development for ensuring a safe health of the patients. The senior authority concludes the senior nursing as well as the guidelines conclude that code of conduct and patient safety has been the main parameters which should have been identified by all the nurses within the hospital settings. The nurses must possess a positive behavior to create a strong therapeutic relationship with the patients. This is very essential, as we know that that most of the patients are reluctant to get an access and to develop a relational capacity with the nurses. Therefore, the nurses are required to demonstrate a very effective strategy to for increased patient engagement, which she can do by effective communication for assessing patient needs as well as preferencing, and thereby designing a care plan based on the preferences of the patient. So this ensures a positive creation of a positive environment where the patient will feel safety as well as his needs and care will all be taken care by the nurses. The positive behavior has become an essential framework to improve patient safety. So why reporting is essential and has become a very important part of this code of ethic. So nurses should remain aware regarding their competence, which is very necessary for current practices. Their scope of practice are based on individual knowledge, practice, education, competence, and lawful authority. Nurses must practice in accordance with the standardized guidelines, are accountable for a stable and healthy healthcare system. So, complying with all these reporting guidelines will ensure a stable and healthy healthcare system where the patients will feel safety as well as they will receive the care as per their needs without compromising their health. The nurses will be able to assess the patient and create prompt diagnosis for the safety of the patients. Any response that may conflict or any lawful practice should be identified by an appropriate authority, and in case a concern remains unresolved and continue to impact patient life, this particular incident or should be reported at the very particular moment. However, in such situations, the nurse must intervene and respond to senior authority for patient safety and wellness. Thereby, reporting is very essential, and the nurses, in case find any error, whether the procedural error or any failure to perform any code of conduct, the same should be reported to the senior authority. So further, we'll discuss how NMBA standard guides a safe communication. Effective therapy involves understanding the verbal as well as non-verbal needs of the patient. Delivering care and treatment is a prime role of the nurses, which lead towards a strong therapeutic relationship. Effective communication is essential for patients as it helps to provide holistic care to them. Therapeutic relationship achieves goal of improved patient output, perk up the quality of the life of the patients and their family members as well. Because as we know that the family members are also a part of the patient and they contribute to most of the safety of the patient. Therefore, a strong communication and therapeutic relationship with the patient as well as the family will support and ensure a safe care plan for the safety of the patient. Moreover, clear communication with co-workers is also essential, which maintains smooth working. In every case, the nurse, in case fail to communicate effectively with the team or as well as with the patient, can increase the harm to the patient life. Skilled nurses staff aims to improve patient outcome by providing physical, mental, and emotional care as well. So the nurses are not only responsible for the physical health of the patient, but as well as contribute her care within her scope of practice to ensure the psychological as well as emotional health of the patient. So which exactly standard is responsible for patient engagement by involving communication? The standard 2 of NMBA guides the nurses to engage communication for safety of the patients. A safe and a strong communication is a key component for achieving the standard of effective care. The NMBA Standard 2 regarding partnering with the consumers also guides the healthcare professionals to build up a strong connection with the patients as well as with the multidisciplinary team members and the family members as well. They have homogenized communication for effective care and safety to improve patient outcomes. The nursing staff develop communication skills by continuous practice, quality education, mentorship. Patients belonging to weaker community lack thorough expressions, and the skilled nurses must, with advanced communication skill, must engage themselves and minimize communication gap to achieve the effective care standards. Nurse providing communication assistance to patients for understanding their needs and preferences. So communication is a way and a very easy and safe way to communicate and interact with the patient to understand their needs and preferences, and thereby designing care plans for their safety. The factors including active listening and questioning acts as a chief element for personal communication and consequently maximizes the effective care among the patients. So the standard 2 guides the nurses how to engage effective communication as per the to interact with the patient, to assess and identify their needs and preferences, and thereby make prompt diagnosis and designing a care plan for the safety of the patients. So standard 2 also supports the nursing professionals to delegate their work. In this case, when the nurse was not able to take the vitals of the patient, the nurse could have engaged critical thinking and delegated the work to a competent nurse practitioner in order to ensure that the work will be done within the required time and for the safety of the patient. As we know that the self-motivated force in nursing practice owes to care. Dynamic essence in nursing is obligatory to the care and respect towards patient, involving a true team of dedication and loyalty. Nursing comes out a more specialized practice in terms of caring and arranging. Nurses are accountable for their actions and decisions which cannot be avoided, and in case the actions and decisions are avoided, it must be delegated as a part of their professional and accountable work. The nurses should communicate effectively while delegating the things as it is directly related to the patient health and well-being. Delegation can be proceeded with competence, assessment, and teaching. In this case, the nurse did not show positive delegation and during her shift, which states a clear contradiction with accountability as mentioned in the NMBA standard 2.6 of practice, which states that the nurses may delegate the work in case they are not finding themselves competent enough, or they are not finding themselves available to perform the activity. And in this case, the nurses are allowed to delegate the work to a competent nurse, while ensuring that the work has been done within the required time. In case the nurse will not be able to delegate the work, it can directly harm to the patient and can increase the risk of both physical as well as psychological risk. So, what other standards are required or were failed by the nurses? So, the standard 3 stands for documentation, which the NMBA guidelines has suggested. As we know that maintaining health record is a growing concept in the healthcare system that focuses to collect all the medical health records of the individual patient for improving their health quality. This will reflect all the intervention, nursing assessment, changes in medication and care which can be used to improve a patient's life in future. Documentation is an important legal requirement of nursing profession. The NMBA guidelines standard 3.6 defines every nurse profession should maintain the medical records or assessment of the patient for their safety. In this case, the nurse failed to document the health records of the patient, which she must have done after administration of the medication, reflecting the unprofessional behavior of the nurse, which later can impact the patient safety as increase the harm to the life of the patient. So what are the ethical and legal aspects of documentation? So the documentation health record provides personal information for patients to authorized users. The information is useful and can be used for effective care and patient well-being. Medical records that justify confidentiality and autonomy bioethic in a secure manner. At the same time, healthcare departments can face various legal and ethical challenges if the nurse fails to save the medical health records of the patient. Therefore, the nurses must ensure a safe documentation as a part of a legal and ethical duty and must keep a safe track on the documented medical records in order to ensure the confidentiality and justify the patient autonomy. Medical staff should share the knowledge of the importance of documentation records of the patients by taking a written consent for patient autonomy. Maintaining patient health records will reflect a positive attitude towards the nursing profession and defines the quality of care which has been provided to the patient. So documentation is not only a professional part of the nurses, but it also ensures that the nurses had complied with the ethical and legal aspects of the professional body, and has also complied with the standard NMBA guiding standards of nurses in Australia by complying with the documentation standard. So to conclude, we can say that medical support and nursing altogether comes out and create a broader path for effective care and safety. Compassion contributes to the care which patients experience throughout their care process. Arranged caring creates a sense of well-being, which forms a major component for achieving professional behavior. Patient demands for extended care brings an emotional satisfaction in caring process. A complete and arranged caring plan will act as a medical tool and achieve multidisciplinary goals of patient outcome. Multiple caring plans need to be incorporated for providing keep safety and well-being of the patient. So we can say that by complying with the nursing guidelines as well as with the NMBA standards and code of ethics, the nurses can create a strong and safe environment for the patients where the patients will feel safe, and the nurses can provide a patient-centered care for the safety and well-being of the patient. So we can say these were the references which were used to design this presentation, and these are all the resources. So we can say that this presentation will surely increase the knowledge of the nurses students as well as the other healthcare professionals in order to ensure that they must comply with the NMBA standards to ensure the safety and well-being of the patients. Thank you and have a nice day.